magnitude of methamphetamine use is still relatively small. There has been a change in user population, Colin said. We have heroin users or opiate addicts who are now using this crystal meth, he said. They may be people trying to stay off heroin. They may use it to stop some withdrawal symptoms and fight through the opiate sickness, or because it's cheap and they're using it just as another drug. Lieutenant Stephen J. O'Neill Jr., Organized Crime Bureau commander at the Cumberland County Prosecutor's Office, said local narcotic units have kept an eye on the situation and work with the DEA and state laboratories to test substances they seize or find. With the growth of fentanyl and the ever-changing combination of drugs that are being made and sold, O'Neill, who has been in law enforcement for 23 years, said methamphetamines has become more concern among law enforcement in the drug epidemic. It definitely has changed over the years, and not for the better, he said. Well, I'm not surprised. You got to understand, drug addicts rarely just use one drug. They always use a combination of many drugs. It's just like it's very rare when they do an autopsy, it's just one drug in their system, even be up to 3 drugs. That seems to really be the norm out here on how many of them are using drugs. It's not really one drug, it's a combination of drugs. This is an article that came out in Politico August 28th, 2018. You know, when it comes down to opioids, they either go extreme one way or extreme the other way. What I mean by that is they went overboard, giving many of these people 400 and 500 pills in one shot of opioids. And now they're going extreme in the other direction by cutting off nearly everybody that was getting opioids and dependent on it every day. Some of these people had multiple surgeries. Some have cancer and a variety of other reasons on why they are taking opioids to get through the day, because they're in a lot of pain. So now many of these people, because of the epidemic plague that's going on, they're being cut off and they can't find doctors that will prescribe opioids to them. So let's get started with this article. Hundreds of chronic pain patients responding to a political survey described being refused opioid prescriptions they had relied on for years, with sometimes devastating consequences. Last August, John Fawkes told his wife he planned to kill himself. The former law enforcement officer was in constant pain after his doctor had abruptly cut him off the twice-a-day OxyContin that had helped him endure excruciating back pain from a motorcycle crash almost 2 decades ago that left him nearly paralyzed despite multiple surgeries. I came into the office one day and he said, "You have to find another doctor. You can't come here anymore." Fawkes, 58, recalled the doctor gave him one last prescription and sent him away. Like many Americans with chronic disabling pain, Fawkes felt angry and betrayed as the state and federal regulators, starting in the Obama years and intensifying under Trump, cracked down on opioid prescribing to reduce the toll of overdose deaths, which it's not reducing at all. People are just turning to the dark web for the illegal drugs. Hundreds of patients responding to a political reader survey told similar stories of being suddenly refused prescription from medication they'd relied on for years, sometimes just to get out of bed in the morning, and left to suffer untreated pain on top of withdrawal symptoms like vomiting and insomnia. I was pretty much thrown to the curb, said Denise Pascal, 65, who had taken pain meds for decades after 6 back surgeries. Then her pain doctor cut her off and closed her practice without connecting her with another specialist. Many of political respondents described being tapered off narcotics too quickly, or worse, turned away by doctors and left to navigate on their own. Some said they coped by using medical marijuana or CBD oil and extract from marijuana or hemp plants. Others turned to illicit street drugs. This is what I'm saying, despite the fear of buying fentanyl-laced heroin linked to soaring overdose death numbers. A few, like folks, contemplated suicide. I sat my wife down and told her life wasn't worth it, folks said, after he had gone more than a month without pain relief, while also suffering opioid withdrawal symptoms. My pain exceeded my ability to handle it. He had a very frank discussion. We even discussed what gun I would use. Folks found another doctor willing to continue prescribe his medication, but he worries that will happen if the pills stop coming. So he's worried about this doctor cutting him off. And they are pressuring these doctors not to give a lot of pain medication. I know people that recently had surgery done and they got only 1 week. After the 1 week of opioids ran out, that was it. They had to deal with the pain on their own. That's what they're doing to people now. Now there's this ticking time bomb, he said. I don't know when it's going to go off again. That's not an idle fear. Trump, who vowed during his campaign to combat the opioid plague, has set a goal of cutting off prescriptions by 1/3 over the next 3 years. He has also boasted of stepped up prosecutions of doctors who prescribe inappropriately and sought tougher sentences for those who sell drugs illegally. While Trump has stressed a law enforcement approach, including broader use of the death penalty for traffickers, his administration has also invested billions in prevention, treatment, and research, and last week authorized a respected science group to develop better guidelines for doctors about how to safely treat patients with severe pain. Certainly, stories like Falks and Pascal illustrate the unintended consequences of efforts to suddenly reverse years of loose prescription practices that fueled an addiction crisis, and why so many of the estimated 25 million Americans suffering from chronic pain feel angry and forsaken. While studies suggest that other therapies are safer and more effective for many chronic conditions, large numbers of these patients are now hooked on the narcotics and are on relief they say they get from constant grinding pain. I have a lot of anger because I think there were a lot of things done wrong to all of us, Pascal said. Well, like I said, these folks are going to get fed up with the pain, and then they're going to go to the illegal drug. You know, it's almost like they set you up to do something wrong. But, we know that. We know that. But they set you up to go out there and do something wrong. So these people are going to go to the dark web, go out on the streets, get the heroin and everything they can to curb the pain that they're in. And then this government will tell them they're wrong for getting the illegal drugs. But see, what you got to understand, people are not going to just sit there and tolerate pain because you decided to cut them off. That's not how people operate. Not in this country. Many doctors and pharmacists responding to Politico's survey acknowledge such patient predicament, but they said they feel under enormous pressure to limit the power of painkillers and fearful of consequences, such as losing their licenses or even prison time for inappropriate prescribing. The Justice Department has aggressively prosecuted doctors for improper prescribing or fraud, changing nearly 200 doctors and another 220 medical personnel for opioid-related crimes since January 2017, the DOJ said in a June press release. Nonetheless, the toll of overdoses keep mounting. Almost 70,000 people died of drug overdoses last year. According to the latest government numbers, about 49,000 were opioid-related, including legal and illegal painkillers, as well as street heroin and fentanyl. I will no longer treat chronic pain, period, said Sue Lewis, a primary care doctor who works in an urgent care clinic in Portland, Oregon. There is too much risk involved, she said, adding that if a patient doesn't take the medication as she prescribes them, they could jeopardize her license. Stephen Henson, an emergency room doctor, so he's in Wichita, Kansas, described how his license was suspended after 6 patients illegally sold medication he prescribed without his knowledge. Okay. So now that makes sense. So these doctors don't want to lose their license, so they figure they'll just cut their people off and stay safe from prescribing any opioids. The DEA should be working with doctors when this happens as opposed to punishing them, Henson said. Ching Gao Chang, president of the Board for American Academy of Pain Medicine, said that besides being scared, many doctors are also fed up with time-consuming requirements, including pill counting, where a patient brings her prescribed medication to the clinic so the doctor can make sure they aren't being misused. Doctors also have to order regular urine tests to detect abuse. And few are trained how to safely wean someone off opioids. Some patients told Politico their doctors failed to treat their withdrawal symptoms, and they were sick for weeks after being tapered off their pain killers. Any doctor can prescribe a powerful painkiller like oxycodone, but a physician has to go through special training and licensing to prescribe some drugs used to treat addiction. About 5% of U.S. physicians have been certified to prescribe. All right, so I just take it that these doctors would rather walk away from giving any pills than end up in all kinds of legal problems that the Trump administration have in place. Few saw the approach wave, but the effort to overhaul opioid prescribing began with little fanfare in March 2016, when Obama CDC issued controversial first of its kind guidelines advising primary care doctors to prescribe opioids only as a last resort for pain, and then in the lowest effective dose. The guidance suggests a 3-day limit for initial prescriptions for acute pain and recommended avoiding prescribing increased large doses for those complaining of chronic pain. It was aimed at primary care doctors at an outpatient setting, not at specialists treating people with complex chronic conditions or those with advanced cancer. The CDC specifically excluded active cancer treatment, palliative care, and end-of-life care, as well as the use of opioids in surgical and trauma settings. Nonetheless, groups including the American Medical Association, the American Cancer Society Action Network raised concerns about unintended consequences for certain chronic pain patients, including cancer survivors who often deal with lifelong pain. AMA also raised concerns about the evidence underlying the guidelines. Since then, at least 32 states have enacted laws relating to limiting opioid prescriptions, with exceptions for cancer. And so well, it's not all 50 states, but 32 states do have some exceptions. Okay. Most center on acute pain, but Oregon is considering a 90-day prescribing limit on many chronic pain patients in Medicaid. Those patients would have to go off the drug within a year. The guidelines have also served as a template for insurers like Anthem and pharmacy chains, including CVS, Caremark, that have capped initial opioid prescriptions. The Trump administration has also finalized opioid prescribing limits for initial prescriptions in Medicare Part D to take effect next year. So let me just go down here. Now, some patients are beginning to fight back. We thought we should be the ones being consulted because you're talking about taking our medication, said Lawrence DeLuca, president of the Boston-based Chronic Illness Advocacy Awareness Group, formed last November by DeLuca and another chronic pain patient to lobby state and federal lawmakers on behalf of those with chronic pain. Some doctors are also questioning guidelines that they say tie their hands when it comes to chronically ill patients. You know what the problem is too, that just popped in my mind? A lot of these people are lying about being in pain just to get the medication. And I think that might account for the fact why they go so overboard with this whole thing. So, the rest of the article, they're talking about, training doctors, giving them better training for pain management, and also trying other alternatives like acupuncture, but see, you got to understand, acupuncture is not covered by insurance. Because I remember some people I worked with did acupuncture, but you got to pay out of pocket for that. Usually your health insurance will not cover acupuncture. Like there's certain things you can do, just like holistic medication, a lot of that they will not cover, So if you can find a holistic way of dealing with your pain, but just understand that's paid out of pocket. And I know some of these people that are in their 60s and on up, they're living on fixed incomes. So that's why they're relying on their insurance to be able to get the painkillers that they need on a regular basis. Okay. So Brown and other chronic pain patients who responded to Politico's survey say they feel as if they have been pushed to the side in the larger response to the opioid plague. Trump in 2016 made it his mantra to represent the forgotten men and women. Brown said, I speak for a lot of chronic pain folks when I say we are now feeling like those forgotten men and women. So there you go. There are a lot of people in chronic pain no longer have access to the medication. And like I said, this is going to pull them out on the streets or on the dark web looking for the street drug. And now that raises their chances of dying because everything out here is laced in fentanyl. So that's not really safe. But ladies and gentlemen, please tell me what you think. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family. On my old channel, I did an article on the Civil War generals. Some of those generals were so damn dumb. I think children would have done a better job in leading their armies. They were as dumb as dirt. And it was not shocking after reading about many of the generals, why they lost. Okay, you don't let the dummy lead. But let's get into this, ladies and gentlemen. From the Journal of the Civil War Era.org, and I'll leave the link to this article in the description box. But let's get into the South. Civil War veterans and opiate addiction in the Gilded Age. You know, the history that they never want to tell you about. Because if they don't look like heroes in the whole thing, then that history can't be told. But I'm right here to shine the big old sunlight on it with some hogweed and wild parsnip, y'all. Let's get into it. In November 2015, two Princeton economists, Dr. Angus Deaton and Dr. Ann Case, published a startling report which indicated that the mortality rates of poorly educated, middle-aged white Americans had skyrocketed. These mortality rates, Deaton and Case argued, were not being driven by the usual suspects of diabetes or heart disease, but by suicide, alcoholism, and opioid addiction. Among 45 to 54-year-old with no more than a high school education, death rates increased by 134 per 100,000 from 1999 to 2014. This sad revelation has been billed as unparalleled in American history, with Dr. Deaton himself unable to find a historical comparison. However, rampant opioid addiction rates do have a historical parallel here in the United States, and especially the American South. After the Civil War, Southern whites during the Gilded Age arguably had the highest addiction rates in the country and possibly the world. How do we know? Some of the evidence is anecdotal. For instance, in The Opium Habit, published in 1868, Horace B. Day estimated 80,000 to 100,000 Americans were addicted to opium. In 1915, Congress passed the Harrison Narcotic Act. See, they were passing bills for drugs back then, and guess what they're doing today? Passing bills for drugs today, which required anyone who imported, produced, sold, or dispensed narcotics to register, pay a tax, and keep detailed records. David Courtwright, a historian of addiction, analyzed these records from the Harrison Act and demonstrated that addiction rates in the South were much worse than anywhere else. Now, you think about that, ladies and gentlemen. Slavery ended. The slaves left the plantation. The South collapsed. They went through a famine. And on top of all of that, there was drug addiction running rampant in the South. Now, do you understand why they could not rise without all kinds of help with building it back up? The North had to pour money into the South, and then they had to come up with the 13th Amendment to get the slaves back down there and get you back out there doing free servitude again, because they couldn't do it on their own, ladies and gentlemen. They didn't do all that work on their own. As usual, they needed a lot of help. So let's get back into this. In Atlanta, for instance, 2 out of every 1,000 people were addicted to an opioid. The worst southern city, though, was Shreveport, Louisiana, where almost 10 out of every 1,000 were addicted to opium or morphine. These numbers were much higher than anywhere else in the United States, arguably in the world. Addiction rates were not born equally among Southerners either. White Southerners were far likelier to consume opium or heroin than Black Southerners. And this is one of the books, The Age of Drugs by Louis Dalrymple, I don't know, 1900, courtesy of the Library of Congress. So they even wrote books, ladies and gentlemen, about their drug addiction. They even wrote books about it. Ain't those kids walking out with some drugs? Some kids, or illustration of kids getting some drugs. All right, let's move on. Why was opium and morphine addiction so rampant in the United States in the Gilded Age? The answer rests with the outcome of the Civil War. Thousands of Civil War soldiers who were wounded during combat, or more commonly became sick in camp, were first dosed with opium or morphine in the field hospitals during the war. Many came home struggling with addiction to narcotics. First tasted in a hospital, one Union soldier who had endured 10 months of prison life at Andersonville returned home with an opium addiction. first doled out at a hospital in Wilmington. He regularly consumed opium, but when he tried to quit cold turkey, found that opium had an incredibly strong hold on him. No tongue or pen will ever describe the depths of horror in which my life was plunged at this time. The days of humiliation and anguish, nights of terror and agony, though which I dragged my wretched being, he wrote. And here you see somebody laying in an opium den right here, all strung out on opium. You know, that this was 1904 when our people were getting locked up for free servitude again through the 13th Amendment and sharecropping, y'all. Sharecropping. We were out doing backbreaking work and they were getting high. All right, moving on. Confederate soldiers returned to a defeated and humiliated South, with cities like Atlanta in near ruin. And do you know many of them soldiers ran away as fugitives out of the South? Some went as far as Canada after the Civil War because they were afraid they would be arrested. Furthermore, 1 out of every 5 Southern males of military age were killed in the war. Many heartbroken families turned to drugs to cope with the devastating loss of a husband, son, brother, or father. Maimed and shattered survivors from 100 battles, field battles. Horace B. Day wrote in 1868, diseased and disabled soldiers released from hostile prisons, anguished and hopeless wives and mothers, made so by the slaughter of those who were dearest to them, have found many of them temporary relief from their sufferings in opium. So in order for them to get through their grieving, they had to use drugs for that, ladies and gentlemen. They needed drugs to get through hard times. Yes, they needed drugs to get through hard times. So today, much of the opioid plague stems from prescription drug use. The CDC claimed in 2014 that every day 46 people die from a prescription drug overdose. Prescription drug abuse fueled the opioid plague during the Gilded Age as well. Opium, heroin, and morphine were legal tools for the apothecary physician during and after the Civil War. The science of addiction had not yet emerged, and doctors prescribed opium and morphine regularly for pain management and sleep problems. A.M. Chappell was a veteran of the 14th Virginia Infantry and had been wounded at the Battle of Gettysburg when a ball crashed through his left knee. It was a wound that Chappell noted would never get entirely over. By 1886, Chappell was very poor indeed, and with a wife and children to support. He wrote to Lee Camp Soldiers Home for admissions into the institution. In his letter, he noted the lingering disability, poverty, and his addiction to morphine. Ladies and gentlemen, the South was in bad shape. Again, they could not do it without the help of slaves and money being poured into the South to bring them back to the state they are in today. They did not do this on their own. This was also another reason why the 13th Amendment was a necessity, because the South had to be built back again. And as you could see, many of these people were junkies. They sure couldn't do it. Strung out on drugs. The majority of the people in the South strung out on drugs. What are they going to build? If they couldn't build up this country without drugs, you know damn well they can't do it with drugs. Okay, moving on. The destruction of slavery and the Southern slave economy. That is the only economy that fueled America, ladies and gentlemen. That's why it was called the slave economy, because all of the wealth that America had obtained came through slavery. So when these people try to deny these things, all you got to do is go back in history and just look up slave economy. They sure didn't call it anything else, because that's where everything came from in America. Everything. Also led many Southerners to turn to drug use. See, because they no longer had their slave, they no longer had their livelihood, so they turned to drugs. The 13th Amendment to the Constitution legally overthrew the system of slavery, and 4 million African American men, women, and children were free. In an instant, when they abolished slavery and it was wiped out, billions of dollars in slave capital. Okay, so when they wiped out slavery, they also wiped out billions that these people could no longer earn, because the slaves were not there carrying their behinds all through Southern history and American history, because slavery was everywhere. And I already did a video on that one. Okay. In addition, the introduction of wage labor along with international competition hobbled the cotton industry. Slavery was an immoral and incredibly cruel institution with no redeeming qualities. Its destruction was long overdue. Yeah, well, some of these people walk around even today acting like they're a slave master, so they are definitely that in their minds. Okay. But the institution's demise wiped out vast sums of wealth in the American South, leaving many white Southerners destitute and impoverished. Wait a minute. I thought you could do everything and you didn't need nobody. Okay. To me, when the slaves walked away, that was your big chance to show that you could farm your own land, grow your own food, and run your own economy without no one's help. But it didn't pan out that way, did it? Didn't turn out that way. There's a reason for that, ladies and gentlemen. There's a reason for that. Okay? Now, to this day, these are the same people that try to tell us we need them. But history shows it's the other way around. Now, if they were indeed the capable people that they claim they are, then the South should have never gone through a famine. The South should have never collapsed. The South should have been able to get on their feet without no one else's help. But it didn't turn out that way. The 13th Amendment put our people back in servitude. Who do you think built the South back up after the Civil War? These junkies? Nah, ladies and gentlemen. No, no, no. If you're impoverished and you're destitute and you got a major, major drug problem in the South, your ass ain't building anything. Just wanted to shed some light on that. So when the slaves left, billions of dollars also left the South, ladies and gentlemen, because they didn't have anybody to mooch off of anymore. So let's move on. In addition, the introduction of wage labor along with international competition hobbled the cotton industry. Slavery was, yeah, we know that. But the institution demise wiped out vast sums of wealth. So wait a minute, if you didn't need us, then how did that wipe out wealth? Get out there and do the work yourself. What's the problem? You can't. Okay, sunscreen didn't exist back then. You would have burnt up and died. So many of the white Southerners were destitute and impoverished. To cope with this sudden loss, many Southerners turned to drug use. So, ladies and gentlemen, let me repeat this again. The South fell. The Civil War veterans were junkies. Many of the people, civilians, were junkies. They went through a famine. They were poor. They were destitute. They were foreclosed on. And they could not build up the South with all of these useless people down there. How you going to build the South back up with a bunch of junkies? You couldn't. You couldn't. That manpower came from Black men, women, and children. That's what built that South back up. That's what I'm trying to show you. They were in no shape to rebuild the South. Reality is something else, ain't it? Let's move on. This was clear to many Americans living in the Gilded Age. Since the close of the war, remarked by a New York opium dealer, men once wealthy but impoverished by the rebellion. So wealthy people became poor in the South, y'all. The wealthy became poor. Have taken to eating and drinking opium to drown their sorrows. It also explains why the weight of addiction was not carried equally between the races. Black Southerners were far less likely to be addicts, partly because the defeat of the Confederacy was celebrated, not mourned. Now, I don't think why would they celebrate the Confederacy? In the wake of the death and destruction of the war, those most affected by it, soldiers and Southern whites, turned to opium in alarming numbers. Many addicts first introduce an opioid in a hospital or by a family physician. They use opium or morphine to cope with the lingering illness or injury, grief, or economic loss from the war. While much different, the modern opioid plague is not the first. Deindustrialization and the shredding of the social safety net has been high school educated, middle-aged whites with few options. Many have turned to opioids to cope, just like they're turning to it now. So, ladies and gentlemen, I wanted to shed light on two things. The shape these folks were in after the Civil War. There is no way they can make the claim that they were the ones to rebuild the South. Black people rebuilt that South. They weren't strung out on drugs. These folks were strung out on drugs. They were impoverished. They went through a famine. They couldn't even cope in life without drugs. They lost all of their wealth. So all of their wealth was tied to slavery. They didn't have their wealth any other way. If that were not the case, you should not have lost a dime when the slaves walked away. When the slaves walked away, all of their money was gone. So everything they had was tied to slavery. And there's no way they rebuilt the South in the shape that they were in down there. No way. Please leave your comment and subscribe. Don't forget to hit on the notification bell. And ladies and gentlemen, I will see you on the next video. We rebuilt the South. Period. Peace, family. And gentlemen, there seems to be another plague emerging among teens in this country, and that's Xanax abuse. This article came out August 26, 2018 in the benbulletin.com, and this is out of Baltimore. Teen drug abuse during the summer often goes unnoticed. It's when students start school and nod off in class, that's when they realize there's a problem. And you know, teens, they're exchanging drugs with each other in the hallway, and they notice when they're sleeping more often in class and they're failing their exams, and and they see other indicators with the student being groggy all day that there is an addiction problem. This year, the school year addiction specialists say they're expecting an onslaught of teens addicted to Xanax and other sedatives in a class of anti-anxiety drugs known as benzos. Now, teens believe that the Xanax is actually safer than opioids or heroin, but actually, ladies and gentlemen, it's worse, because this is the hardest addiction to kick is Xanax. Okay, the percentage of people beating a Xanax habit is extremely low. Most don't. The majority don't beat the addiction at all. Okay, so these kids are going into their parents' and grandparents' medicine cabinets and stealing these drugs. And they're taking the drug, the Xanax, along with opioids and alcohol, which is deadly. And a lot of times when they're going through withdrawal symptoms, they have to be taken to the hospital because they start having so many violent seizures from the Xanax. So it's pretty bad. So they end up in the hospital more often with this particular addiction. Adolescents benzo use has skyrocketed, Levy said, and more kids are being admitted to hospitals for benzo withdrawal because the seizures are so dangerous. At the same time, she said far fewer kids are seeking treatment for prescription opioid addiction. Well, you know what? It's a low percentage of people, even among adults, that are seeking treatment. That's one thing about people with a drug addiction. Most of them will refuse rehab. When I asked them if they were using opioids, they say no, they wouldn't touch that stuff. Benzos over opioids. Mark Fishman, an addiction psychiatrist and professor at Johns Hopkins University of Medicine, says benzos are quickly overtaking opioids as the primary prescription drug of abuse among adolescent patients he sees at Mountain Manor Treatment Center in Baltimore and other Maryland locations. And many of them are extreme, high dose users, he said, like opioids prescribed for pain, benzos prescribed for anxiety eventually stop working, forcing users to take higher and higher doses to get the same effect. Kids who can't get the pills at home buy them on the dark web or concoct designer versions of benzos in their bathtubs. He said people with mental illness are at much higher risk of developing an addiction to opioids. And Fishman said the connection between mental illness and benzo is even higher. 3 FDA-approved medicines are available to treat the symptoms of opioid addiction. Okay, so you know how America is. They substitute a drug for a drug when they have you in rehab. But those rehab drugs are addictive too, you know. And this is why a place like Russia, they go cold turkey. They said it does not make any sense to use a drug to treat a drug addiction. But that's what America does. And that's all this is going over. But no medicines exist to blunt the withdrawal symptoms and cravings associated with benzo addiction. Instead, patients typically enter residential treatment where a specialist gradually tapers them off the medication. If stopped too quickly, benzo withdrawal can result in seizures and even death. Wow. That alone would keep me from taking it. For people who overdose on opioids, Narcan is widely available and can easily be administered by first responders, friends, and family members who to block the deadly respiratory depression of opioids. A similar drug, flumezanils, can block the respiratory depression of benzo. Oh my God. So now they're going to have to carry this flumezanils and Narcan because somebody, oh my goodness. So they now got a second drug that can bring back people that OD on Xanax. So I guess the Narcan doesn't work, so they have to use a different drug. Wow. But it's rarely available outside of hospitals. The burgeoning abuse of Xanax and other benzos among high school kids and young adults over the last several years primarily stem from the fact that there are more of the pills out there, Levy argues. Yeah, because it's easy for them to get. Remember, when they are prescribed drugs, they get hundreds of pills in one shot. Okay? So this is why these addictions are going on. As more adults are prescribed Xanax, Valium, and other benzos to calm their nerves and promote sleep, we're creating these vast reservoirs for kids to find, she said. The other problem, she said, is that Adolescents think that benzos are safe because their parents use them. Many kids say they don't take the pill to get high, they take them to feel normal, Levy said. Well, what's wrong with your kids where they don't feel normal? What's wrong with these people and their kids? I'm serious. Some patients even ask me to just prescribe Xanax for them so they don't have to buy it illegally. They think it's good for them. That's one idea, that something is safe or beneficial or medical has launched many an epidemic in the past, Levy says. So my colleagues and I are watching with trepidation. But you know what, ladies and gentlemen, the problem in America, even if you don't use the illegal drugs, drugs are so readily available. It doesn't matter if it's a prescription drug or an illegal drug. It's plentiful in this country. It's plentiful. Any of us can walk out of our front doors and probably be able to locate and find where to buy drugs and illicit drugs, or even go on the dark web for it. It's easy to get, and it's just readily available everywhere. And as long as that is the case, drug addiction in America will never go anywhere. It takes away everything you have in your mind that's bothering you, and everything you feel that hurts. And before you know it, those feelings are just gone. Melissa was 15 then and just entering high school. She's now 24 and struggling to take care of her 3-year-old son. She says she's determined to beat her addiction to Xanax and be free of all drugs except the depression medicine she's been taking for more than a decade. Wow. I guess they really do have the most mental illness. Maybe they're telling the truth, y'all. Otherwise, she said, she could lose her son. Wow. The first time Melissa tried to stop Xanax was about 4 months, when she was 4 months pregnant, and she managed to get through her pregnancy without relapsing. But the day after her son was born, I told my friend in the hospital to bring me some, and I started all over again. So after she gave birth and really should have been in a position to take care of her son, she relapsed with an addiction. Melissa also started injecting heroin then. The two drugs are made for each other, she said. When one doesn't have what one doesn't have, the other does. With the dope heroin, the high doesn't last as long as Xanax. So I was more into Xanax. But after she started combining the two, she overdosed. That's when she first checked into Mountain Manor. I guess that's your rehab center. Wow. I got so much closer to my son back then, she said wistfully. Everything was better. I was doing good, but I started hanging out with old friends and I relapsed on Xanax. Now she's back in Mountain Manor. She hopes to leave treatment by the end of the week and move into a mother-child sober living facility. I didn't even know that existed. For now, her mother is taking care of herself. Withdrawal from Xanax can cause irritability, insomnia, anxiety, panic attacks, tremors, nausea, and flu-like symptoms. And unlike opioid withdrawal, which usually lasts for about a week, it can last for months. Oh my goodness, withdrawal from Xanax can last for months? Oh, well, now it makes sense that it's the hardest one to beat. Because if you figure if it lasts for months, then they want relief, they'll go back to the Xanax. So, okay, now I understand. Treatment is scary all around. It's fine when you're here You can't go down the street and meet your dealer. The scariest part is when you go back out there. All right. So Xanax withdrawal, y'all, can last for months, and it's the hardest addiction to beat. And the teens, it looks like there is a new plague among the teens in America, Xanax. Please tell me what you think. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I will see you on the next video. Peace, family. Ladies and gentlemen, this is a story that comes out of Milwaukee, WTMJ, and it's dated August 23rd, 2018. August 23rd, 2018. Recruiting company recommends employers get rid of drug testing, and it's because so many people are not passing these pre-employment drug testing. A lot of them just want to stop using them just to get people hired. And really, they're opening up another can of worms because Wisconsin are missing out on the least 20% of the workforce, which these days is all tight. You've got some companies that are dying for workers, but then there's a pool of people that want to work but aren't able to get jobs, Weslow said. Doing away with pre-employment drug testing, Weslow believes, is the solution to a worker shortage in Wisconsin, specifically for jobs where accidents are less likely to happen, like clerical positions. There's a pool of workers that can't pass drug tests, whether it's THC, whether they have medical reasons to use it. They should be allowed to have opportunities for employment, Weslow continued. Lori Greenlee, with an employer associated company, MRA, the management association, said her company recently conducted a poll of employers in southeastern Wisconsin. It asked companies if they can discontinue marijuana from their drug screening process. 73% said no, 1% said yes. I would never recommend removing the pre-employment drug screening from any position that is a safety-sensitive position. So these are positions, locations in the state, and Weslow said whether his employer clients are interested in the possibility of dropping the drug screening, no one is ready just yet. It's kind of like a roadblock. Nobody wants to be the first to jump in the pool, said Weslow. I don't know. I know they're doing this as an act of desperation because many of their own people are not passing these drug tests, ladies and gentlemen, and that's really a huge problem. They're not passing. And there are a lot of open jobs right now across America that can't be filled because so many of these people either have a background in drugs and companies don't want to take the risk of them relapsing, or they just can't pass a drug test at all. And that's been an ongoing problem in this country. But please tell me what you think.
But please tell me what you think, ladies and gentlemen, about them thinking about the possibility of dropping the pre employment drug test for certain positions. Please leave your comment and subscribe. Don't forget to hit on the 2018. The opioid plague by the numbers. In 2016, 116 people died every day from opioid related drug overdoses. 11.5 million people misused prescription opioids. 42,249 people died from overdosing. 2.1 million people had an opioid disorder. 948,000 people used heroin. 170,000 people use heroin for the first time. 2.1 million people misuse prescription opioids for the first time. 17,087 people deaths attributed to overdosing on commonly prescribed opioids. 19,413 deaths attributed to overdosing on synthetic opioids other than methadone. 15,469 deaths attributed to overdosing on heroin, and 504 billion in economic costs. I mean, these drug addicts are costing a fortune, y'all. Okay. The rapid increase of opioid overdose deaths in rural communities across the country has far outpaced the overdose rate in urban areas, and an Iowa State University led research team wants to know why. The researchers' goal is to identify prevention strategies and use big data to predict which communities may be at risk, said David Peters, an associate professor of rural sociology at Iowa State, who is leading the 5-year project. All right, let me just go down a little. Rural areas hit hardest by the opioid plague have often experienced some type of economic shock, Peters said. In many cases, manufacturing plants have closed or farms have consolidated, resulting in a loss of jobs. Peters says such hardships does not automatically put a community at risk for increased opioid use, but there appears to be a connection between how the community responds to economic decline and its risk. We think local action plays a role in why some of these communities are more resilient in the face of the opioid plague and why others are not, Peter said. The opioid plague seems to be the center seems to be centered in areas where it's not just economic decline, but there's a decline in everything: infrastructure, buildings, quality of life. The community is a withering place. Learning from the communities. There is limited research on the factors driving the opioid plague and no evidence based strategies for how communities can minimize or prevent it, Peter said. Previous research of economically distressed communities show residents tend to disengage and social networks start to break down. Hostetler says residents may be less likely to monitor public spaces or work with police to reduce crime. With this level of disorganization, we see a shift in cultural norms that make a community less likely to condemn illicit behavior and prevent crime. Hostetler said, if communities are not proactive and that economic shock leads to higher poverty and crime rates, graffiti, trash, and abandoned buildings, you're going to have more social problems. Researchers will work directly with those affected by opioids to collect data and identify what has and hasn't worked in fighting the plague. They are developing an advisory panel which will include law enforcement and court officials, public health experts, city and county leaders, and medical professionals, as well as addicts and family members to help guide their research, Peter said. The work will focus specifically on rural areas and micropolitan communities, populations between 10,000 and 50,000 in different regions of the country. Researchers expect to find differences in urban areas driven by farming, forestry, and mining, and want to develop appropriate strategies based on those economic factors, predicting risk with big data. A concern for researchers and communities alike is the lag time for data on opioid arrest and deaths, Peter said. The data can identify potential problems, but the most recent statistics are often 2 years old. Researchers want to eliminate this barrier by using big data to develop a real time opioid risk indicator for communities. To predict community risk, we must understand the local dynamics, the community's connectivity to other areas, the risk there, Davis said. We don't yet know how all indicators for opioids are linked, but we're going to look at uh, data on people, economic situations, previous risk in the area, and potential trafficking patterns. All of this data combined should help form a picture of the local risk. The ability to predict is what will set this risk indicator apart from other data sources. If researchers are successful, communities can use the tool to identify the risk and take action before it becomes a larger problem. Researchers will test the tool in 12 communities as part of a 5 year project. So, you know, you can clearly tell they really don't know the answer to ending this plague, ladies and gentlemen. They have been doing researches and studies and all kinds of testing and evaluating for years now, and they still have no solution. You know, I recently did an article where they pretty much admitted that they can't stop this thing, and they can't. They can't. You know, they can try certain things, but see, when you got so many addicts out here on the drugs and it has spiraled out of control over a 20-year period, you're not going to get it under control now. It's too many people, and you'll have too many that will fall through the cracks that you don't know about. But please, ladies and gentlemen, tell me what you think about this article. You know, I think they can probably identify areas where it's a lot of addiction, but as far as keeping it from spreading, I just don't see it. You know, again, these articles always miss one big key component, and that is the street drug. and all of the fentanyl that's pouring in here from China. It is so much in here. And, and you got to also think about this. Even if they tried to head off some of the fentanyl, you still got Mexico and Canada that's also being flooded with fentanyl. Really, all of North America. So it's not just the US, you got the surrounding countries, and you got those islands that are getting fentanyl, and all of those drugs are coming right here to this country. You know, so even if you reduce writing prescriptions, you still got to battle the street drug, and they really can't do that. But tell me what you think, ladies and gentlemen. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I will see you on the next video. Peace, family.
With the recent trade war going on, China don't care about all this fentanyl coming into the US. They simply don't care. And it is pouring in this country, and people are dying in droves every single week from fentanyl related drugs. And as this trade war heats up, so will all of the fentanyl pouring in as China looked the other way. Trump, poisonous synthetic heroin, fentanyl pouring in from China. And as I stated before, many of these people here in the US from China are heavily involved in this stuff. Don't you believe for one moment that they're not. This story came out on AL.com August 20th, 2018. Trump on Monday urged the Republican-led Senate to pass legislation intended to crack down on shipments of illicit fentanyl through the international postal system, writing on Twitter, "No more delay." Leaders from both chambers announced a bipartisan agreement in June on Synthetic Trafficking and Overdose Prevention Act, which the House passed shortly thereafter. The Senate has yet to act on the bill, as Majority Leader Mitch McConnell, Republican Kentucky, has focused on confirming federal judges and passing appropriation bills. It is outrageous that poisonous synthetic heroin, fentanyl, comes pouring in to the U.S. Postal Service from China, Trump wrote on Twitter. "We can and we must end this now. The Senate should pass the STOP Act and firmly stop this poison from killing our children and destroying our country. No more delay." All right, so Trump's tweet did not mention McConnell or explicitly place blame on what he considers to be a delay. Some critics have accused McConnell of delaying a vote on legislation tackling the opioid plague because passage would give vulnerable red state Democrats an accomplishment to campaign on back home. His office has denied this and predicted quick action. Among other provisions, the STOP Act would require the Postal Service to install the same tracking system used by private shippers, such as FedEx, to attempt to curb shipments of fentanyl. A congressional report released earlier this year found that online sellers of fentanyl preferred to ship through the Postal Service rather than private shippers because they see less of a risk that packages will be seized by U.S. Customs and Border Protection. The Center for Disease Control and Prevention reported preliminary estimates that more than 72,000 people died of drug overdoses in the United States last year, an increase of 9.5% from the year before. One reason for the increase is illicit and deadly fentanyl, which has increasingly been cut into heroin and cocaine. At a cabinet meeting last week, Trump accused China of sending that garbage and killing our people, adding, "It's almost a form of warfare." Almost? Almost, Trump? No, it is warfare. And I went over that just a week ago in a video. Ladies and gentlemen, please tell me what you think. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I will see you on the next video. Peace, family. Ladies and gentlemen, this is a story that came out on Vox.com. I'll leave the link to this article in the description box. They're admitting they're failing at the opioid plague. Are we surprised? No. No, we're not, because this, the stories that I have done over the past year is very clear that they are not finding a solution for this thing. And Narcan is just a Band-Aid. But it certainly is not stopping the high number of people that are still overdosing. So let's get into this story that came out on the 23rd of August, 2018. The opioid plague is the deadliest drug overdose crisis in U.S. history, on track to kill more people over the next decade that currently live in the entire American city like Miami or Baltimore. A new study published in the American Journal of Public Health on Thursday by Stanford researcher Allison Pitt, Keith Humphreys, and Margaret Brando tries to parse out how America can reduce the death toll using a mathematical model. The study brings together research and expert opinions to calculate the epidemic death toll and how different policy ideas can stem the toll. So they're saying that it's 510,000 people, which is a rough estimate, but I'm telling you, every number they give, just anticipate that it's low. That's a rough estimate on how many people will die over the next decade due to opioid-related causes, which include overdoses and other causes of death tied to opioids, such as HIV infections from sharing syringes. But the researchers caution that the number, as with other estimates in the study, are fuzzy and subject to change. Given that this is, after all, trying to predict the future, the trend that we've seen in the last year would suggest that there's reason to believe that death toll could be even greater. No, it is. Really, Pitt told me, referring to data showing a rise in opioid overdose deaths in 2017. But it's really hard to say. Now, let me just go down. Now, they're looking at potential solutions. No offense, but common sense should tell them the way that they're doing things is not working. And their solution is give amnesty to the drug addict and anybody that calls 911, and they shouldn't go to jail. It's a public health issue, and we need more Narcan on the shelf. Those are not solutions, y'all. I think if you don't know that by now, you just simply don't want to know it. I mean, you have all those things in place and it's not putting a dent in the number of people that are dying, then common sense needs to tell you that those things are not the solution. The model, for example, estimated a wider availability of naloxone could reduce opioid-related deaths by 21,200 over 10 years. That medication-based treatment for opioid addiction, buprenorphine and methadone would reduce deaths by 12,500. And that reductions, painkiller prescribing for acute pain would reduce death by 8,000. And these are, first of all, they've already reduced prescribing it. Those are not the answers, ladies and gentlemen. And let me explain why. None of those things they're proposing is the answer, because you know what? There's always the street drug. And they're not even talking about the street drug that people are going out there and getting. What's killing people today is mainly fentanyl. And it's fentanyl mixed in with other drugs. And they're talking about all this other stuff and they're completely leaving out fentanyl. And this is why what they're proposing is just a load of garbage. And it's not going to do anything in reducing deaths if you don't do anything about the street drugs, period. Again, researchers caution that the individual numbers here aren't too important since this is a model making predictions. These figures are not totally acute. Instead, what's important is the overall story that they tell us. So as you can see, over the last 10 years, these are things they got in place. They got the needle exchange in place where your drug user can get clean needles. Psychosocial treatment, medication-based treatment, and naloxone availability. Those are things they got in place in the last 10 years, and these deaths are still in high number. On the harm reduction and treatment front, the model suggests that several interventions, more naloxone, more needle exchanges, more medication-based treatment, more psychosocial treatment. Where it gets a little messier is the prescription painkiller control side. With these policies, the model suggests that some intervention could actually increase the number of deaths within 5 and in fewer cases 10 years. How different policy intervention would affect opioid-related deaths over 10 years. So these are all predictions, and this is just a model of it and reducing it. But like I said, the biggest problem in their research, they don't even touch on the street drugs that are out there. So, I wish them the best. I don't know how you keep going with the status quo every day and you expect to see change. Obviously, somewhere along the line, somebody needs to be smart enough to realize what you're doing is just simply not working. And as long as they keep repeating the same thing over and over, they're not going to see any changes, y'all. Is what they're proposing is a dream. Even this is a dream. You can't say we're going to do something about it and then you leave out the heroin, you leave out the fentanyl, you're leaving out the meth, you're leaving all these other drugs out in your study. So I just don't know what good this is supposed to do when you haven't even hit on another major part in what's slowing down the efforts of turning this thing around. Not to mention, you got Trump that has given very little money towards this epidemic. He hasn't done anything. Anybody can pick up a story and read all the people out here that work, with these folks, with the people that are on drugs. They're saying they're not getting hardly any funding from the Trump administration. So he made it a public health emergency, but he said no new funding. So where do you think this thing is going to go? It's not going to go anywhere. And to be honest with you, I don't think he really cares. He doesn't even talk about the opioid plague anymore. When was the last time he spoke about this? It's been a long time. But please tell me what you think, ladies and gentlemen. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I will see you on the next video. Peace, family. Story that came out in the Philadelphia Inquirer, August 21st, 2018. Fentanyl is killing more and more people in Pennsylvania. This is one of those states that has been hit exceptionally hard. If you remember, in December of 2017, the governor declared a state of an emergency because so many people were packing into the morgues from overdose deaths, and it didn't matter if it was the city, the suburbs, or the rural area. The whole state is really bad. Just as it is in Philadelphia, the synthetic opioid fentanyl is driving the overdose crisis throughout Pennsylvania. New data from the Drug Enforcement Administration show. Fentanyl was present in 67% of the state's 56 overdose deaths in 2017, up from 52% of overdoses in 2016. 4,642 people died. In 2015, overdose deaths across the state have risen by 64%, the DEA said. But the rate that increased slow last year from 2015 to 2016. Deaths rose by 38%. From 2016 to 2017, deaths rose by 18%. In Philadelphia, which has the worst opioid death rate of any major city in the country, 1,217 people died of a drug overdose in 2017. About 22% of the state's total overdose deaths. Fentanyl was present in 84% of those cases. Thomas Farley, Philadelphia Health Commissioner, said the new state-level data suggests that Pennsylvania's opioid plague is no longer confined to urban areas. We've always had a bigger heroin problem than the rest of the state, he said. What I'm struck by is how much of a problem we have in the rural areas that were previously untouched by this. The opioid plague is raging through Pennsylvania like the wildfires are raging through California. He said the rise in fentanyl-related overdoses was particularly concerning. Trust me, ladies and gentlemen, fentanyl is high in the rural areas in Pennsylvania. You know what they do? They micromanage the urban areas, and they don't even think about looking at the rural areas. It's always been in the rural areas, but they don't micromanage them like they do the city. And that's really what it's all about. That's the top drug here. It's 50 times as potent as heroin, much more likely to get people addicted, much more likely to cause an overdose, he said. It's changed the entire nature of the problem. The DEA will issue a more detailed report on the state's overdose death rate this month, but it released these preliminary numbers as the Center for Disease Control and Prevention released its own provisional data on the overdose plague nationwide. Predicting data will show 71,568 overdose deaths between January 2017 and January 2018, which they're lowballing the numbers. It's only 22 states reporting to the CDC. It's difficult to say what's driving the national spike in overdoses, up from 64,000 overdose deaths in 2016, because county coroners often don't report the types of drugs that killed overdose victims on death certificates, which is the only way for the CDC to track such information, said Bob Anderson, chief of the Mortality Statistic Branch at the CDC's National Center for Health Statistics. Still, he said, the increases since 2016 were alarming, although some states in the West and New England reported declines in overdose deaths. The fact that we are seeing some decline in some states is certainly encouraging, Anderson said, but the numbers continue to rise in several of the other areas. I'm hopeful that what we're seeing here in the most recent months is kind of a peak in the problem for the nation, and we'll start to see some declines here. But it's impossible to know for sure until we get some more data. It could be just a small stall, then start going up again. Farley said the statewide data shows. So what he's pretty much saying is right now in the cities and towns across Pennsylvania, they're not seeing much of a decline at this time. And Pennsylvania is one of these states. I would not be surprised if it's one of the top states that have the most opioid deaths. A lot more deaths occur there than even here in the state of New Jersey. Not every small town and every city in Pennsylvania need to do all the steps that are important. Reduce overprescribing of opioids, make drug treatment available, and distribute naloxone, the overdose reversing drug, he said. Now, Pennsylvania, the one thing that makes it unique, in the city area, actually the Latinos have the highest opioid death rates. But when you get to like the rural areas and the suburbs, it's usually more of the non-Hispanic whites. But nevertheless, Pennsylvania is a very troubled state when it comes down to drug addiction. They've always been in this state now for several years. But please tell me what you think, ladies and gentlemen. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family. This is a story that came out on nhpr.org, August 21st, 2018, Dispatches from a Dope Sick America. I'm going to go ahead and play the audio that comes with this article.
This is Fresh Air. I'm Terry Gross. The depth of America's opioid epidemic can be measured in appalling statistics. 2.6 million addicts in the U.S., 72,000 overdose deaths last year, a rate of nearly 200 per day. Our guest Beth Macy takes a ground-level look at the crisis in a new book focusing on Central Appalachia, which she calls the birthplace of the modern opioid epidemic. Macy has spent 3 decades reporting on the region, focusing on social and economic trends and how they affect ordinary people. Her book is an intimate look at cops, judges, drug dealers, young heroin users, and their long-suffering parents, doctors and health activists struggling to fight the epidemic, and executives of a pharmaceutical company that aggressively marketed opioids. Many users became addicted to drugs such as OxyContin when they were prescribed for pain after minor surgery or other treatment, and then moved to heroin when it became harder to get more pills. Beth Macy's previous books include Factory Man and True Vine. Fresh Air's Dave Davies spoke to her about her new book, Dope Sick: Dealers, Doctors, and the Drug Company That Addicted America.
Well, Beth Macy, welcome back to Fresh Air. You begin the book with a visit to a prison inmate named Ronnie Jones, and you spent a long time trying to arrange this visit. Why were you so interested in talking to him?
I had been asked by a mother in Strasburg, Virginia, which is in the northern Shenandoah Valley, full of little idyllic, small farm towns, Civil War monuments. And this mother first met me at her son's grave. His name is Jesse Ballstridge, and he had been the high school football star in the town. She had his grave situated right next to the high school. The cemetery was right next door, and she had his grave on the edge so she could visit him and overlook the football field where he had once been able to move the audience to roars simply by pumping his fists. And he had died of a heroin overdose, and she wanted me to find out, why was her beautiful, burly son, who never missed a day of work, why did he end up dead on somebody else's bathroom floor? So I just started pulling the strings, as we do in journalism, and I found out that he was one of the ways that he became further enmeshed in his addiction was that a twice convicted drug dealer had landed in this region a year earlier and had set about, according to the prosecutors, turning a handful of heroin users into hundreds almost overnight. But of course, it was more complicated than that. So she said, I want you to find out why so I can understand, because I don't understand. I thought it was just pills.
Now, this was a stable middle-class community, and Ronnie Jones, this dealer, I mean, it seems, as you describe it, kind of just took this place by storm and havoc followed. What was distinct about his business model, his way of distributing the drug?
Ronnie had landed in Woodstock, Virginia, near Strasburg. He was serving the final part of a sentence for an earlier drug-related charge. And it was a reentry program designed to help felons get job skills. And when he ended that job, he tried to, as he told me, go legit in town. He tried to set up a business in computer repair, and he said nobody would rent space to him. Nobody would hire him. He ended up losing the chicken plant job when he got sick. And he remembered he had been in the break room of the chicken plant, and he had previously had charges on dealing crack and marijuana. And somebody pointed out that everybody was already hooked on pills here. And they said, if you really want to make money, you're not going to go back to dealing marijuana and crack. You need to bring heroin in.
They were addicted to prescription opioid pills, right?
They were, yes, right. Yes. This is an area where had been a lot of workplace injuries, and the pill problem had been going on for quite some time. And so Ronnie found a connection in Harlem, and he started sending runners or mules up to New York on the Chinatown bus. And the heroin was packaged in these hockey puck shaped like discs that fit inside a Pringles can. And so these young women, largely addicted women themselves, would go up. He would pay them extra. He would pay them in heroin, as he called it. And they would sneak them back. They looked like snacks on the bus, like typically tucked inside pet Pepperidge Farm cookie bags or Pringles cans and inside of a Walmart bag. And so he would bring it back and he would sell it and make a lot of money. And he had a lot of people dealing for him.
These were who? I mean, who does he get to do this?
These were largely addicted women that he found. By the time the feds came after him, investigated him, there were 84 people on a pyramid chart with his name at the top, him and another dealer. And some of the names at the bottom of the chart were crossed out because they had already overdosed. They were tree trimmers. They were high school wrestlers. They were young women who had grown up in foster care. And they were people who had been addicted to pills, and now they were addicted to heroin.
You described this as an evangelical model?
Yeah. So in order to fund your own supply, many people in my book end up selling heroin for people above them. It's called middlemaning. And in order to keep their own supply steady, because they don't want to be dope sick. That is, they don't want to be in this excruciating withdrawal. Some recruit new users. And so that's why it's such a hard thing to put a stop to.
Right. So unlike the kind of drug network that we think of, where there's a dealer that gets big quantities and has a network of people working corners, what he has are users who bring the stuff, recruit their friends, so they can feed their own habit. It's almost like a pyramid scheme, right? Like a network of salespeople that are really users.
Right. And before he was doing that, some people in town were driving up to Baltimore and they were buying it. And when I asked Ronnie about it in prison that day, he said, I actually was giving it to him at a better price and they weren't having to go to Baltimore, where it was much more dangerous. So, he made a lot of justifications for his actions.
Okay, so he ends up getting lots of kids in this community on heroin. Some of them eventually overdose, particularly when the additive fentanyl comes. But let's back up a little bit. Where do most of these kids get started on opioids?
Well, Jesse Ballstridge, who was the football player I told you about, he had snowboarding injuries, football injuries. His mother doesn't know exactly which injury led him to his pill of choice was roxicodone. Roxy's, they called them, and sometime around age 15 or 16. But she didn't really become aware of it until he was 17 or 18. Now, one other thing that I just happened to notice anecdotally as I was reporting this, because I was reporting, kind of running up and down I-81, interviewing all kinds of families, but I noticed that many of the parents of the overdose dead would say, as they were telling me the history, that their child started out with Ritalin as a young kid. They had been diagnosed with ADHD, and the science isn't really clear on that, but we do know that it's largely overdiagnosed. And one of the things kids like Jesse do when they hit that age, and especially when they start experimenting with pills, is they will trade their ADHD medication for stronger drugs such as opioids. And that's what happened in Jesse's case and with numerous of the family members that I interviewed for this book.
A lot of your book deals with the pharmaceutical industry, particularly Purdue Pharma, which marketed OxyContin. They did this at around the time when, the American medical establishment was taking a new interest in treating pain more aggressively. And so lots and lots of these opioid-based pills were being prescribed for people with all kinds of minor surgeries or problems. What were some of the ways that Purdue marketed this drug so aggressively?
Right. So the FDA let them make this squishy claim that because of OxyContin's brand new time release mechanism, which was supposed to allow the pill to bleed out over 12 hours, the FDA allowed them to say that that mechanism was believed to reduce abuse and addiction. And then the marketing team at Purdue went into full frenzy with that. And then that claim was buttressed by old, out-of-date data. And that claim became a certainty. The sales reps went out, especially to distressed communities. They bought data, physician prescribing information, and they went to the communities where competing opioids were already being prescribed in large quantities. So they went to these distressed communities like Lee County, like Machias, Maine, where there were loggers, tree trimmers, coal miners, furniture factory workers, people who had legitimate pain and had used Vicodin, Percocet, Lortab, immediate release opioids. And they sent their reps out to doctors with this notion that addiction with this drug is, quote, exquisitely rare, or only happens in, quote, less than 1% of all cases. And they made that squishy claim a certainty. And then they hired doctors, nurses, and pharmacists, 5,000 of them, to go to seminars and to become paid speakers for OxyContin. And their whole goal at the beginning, you can read it right there in their budget plans, which I cite in the book, is to make OxyContin, which opioids for a whole century had only been used for very severe pain, end of life pain, was to make it acceptable for moderate pain.
One of the things that makes this book such a great read is that you really introduce us to a lot of the people who were involved in this, parents and kids in pain, cops, and doctors and activists who dealt with this. And you write about a guy named Art Van Zee, who was a physician who wanted to go work in a needy community. And he ends up in, was it Lee County in the coal fields?
Yeah, in St. Charles, a very tiny little town.
What did he observe after OxyContin's release there?
So before OxyContin, he told me he had 1 to 2 patients a year that he treated for substance use disorder. After OxyContin was introduced, he was being called out to the hospital at night on overdoses of young people whom he had immunized as babies. He was treating farmers and coal miners. One man said, "I lost my farm, I lost my wife, I've lost everything. That drug became my God." There was one miner that I write about in particular named Arnold Fane Macaulay. He had been injured numerous times in the coal mines and had been prescribed immediate release opioids and had always been able to get off of them before. I mean, he took them as prescribed, but when OxyContin came out, that pill was so strong, so much stronger than those other opioids that he had taken, that he just couldn't do it. And his, family sent him to rehab numerous times. He ends up murdered in a field after he had lost his family, after he had lost everything.
So as this problem increased in the area, there were civil suits filed by some people who felt that Purdue Pharma should be held accountable for the addiction there that had taken the lives of loved ones. The civil suits typically failed because it's hard to specifically pin the cause of death on a specific act.
Right. They always blamed the user for misusing their drug.
Right. But eventually a criminal case emerged. Just tell us a bit about that. Who did it, how it happened?
Sure. U.S. attorney named John Brownlee out of the Roanoke office deputizes a couple of government prosecutors in Abingdon, Virginia, which is very close to the region where Art Van Zee practices and central Appalachia. And they start amassing all this data. They get all the lawyers from the civil cases that were largely lost. I mean, actually, they were all lost. They get all this data. They have boxes and boxes of files, hundreds of boxes of testimonials and depositions, and they start investigating Purdue. And in 2007, there's a big series of negotiations. Rudy Giuliani is brought in to sort of initially try to thwart the investigation. Brownlee holds firm, and it gets negotiated down from, according to recent documents that the New York Times published from the Justice Department, it gets negotiated down from a lot of felony charges to one felony criminal misbranding charge for the company. And then the executives get 3 misdemeanor charges. But during the hearing, which took place in Abingdon on a rainy day, all of these relatives against Purdue Pharma and all these mothers of the early children who had overdosed on OxyContin. Mothers and fathers came from all over the country to look these executives in the eye. And the judge actually let them testify that day. It was quite moving. One of the mothers actually snuck in a little urn of her son's ashes. And as she pulled it out, as she was walking down from the witness stand, she shook it at them and she said, "This is your drug. This is what your drug did to my son."
Shook it at the executives who were there in the defense table. Yeah.
Yes.
Yeah. But to be clear about what actually happened here, I mean, there was an indictment for fraud against the company and 3 executives, right? And in the end, the company pled to what, and the executives pled guilty to what?
They both pled guilty to misbranding, but the company, actually the holding company, the parent company, Purdue Frederick, pled guilty to felony misbranding charges. The executives, they got it negotiated down to they would only plead guilty to misdemeanor charges. And so all the parents on the stand that day said they should go to jail. Even prosecutors in the office now who are just deluged with heroin cases say they should have gone to jail, because in a white collar crime, if nobody goes to jail, the crime's just going to continue. And of course, OxyContin continued being sold, the same formulation, for 3 more years.
And specifically, the company pled guilty to fraudulently marketing the drug for 6 years, right? For misrepresenting it for 6 years, right?
Right. And downplaying the risks of abuse and sort of overselling. And at the press conference, John Brownlee showed charts that the sales reps took out to the doctor's office showing that there were fewer peaks and valleys with OxyContin as opposed to the competing immediate release opioids. And then Brownlee also showed what the truth was that it didn't do what they said it did. And in fact, it set people up for addiction even more. And as I say in the book, the difference between the 2 graphs was the difference between truth and lies.
And did the company change its behavior? Has it?
Well, it reformulated the drug in 2010. A lot of people believe that they only did it because their patent was about to expire. Opioid makers and distributors, they've spent almost $1 billion on political lobbying and campaigns. They've continued deluging American communities with these drugs. I mean, if you look at Eric Ayer's reporting, which won a Pulitzer last year out of Charleston, he writes about a tiny town, Kermit, West Virginia, that has 400 some people. They were sending 9 million pills to that town. And how did they not know that those drugs were being widely diverted and abused?
You write in this book that for people who have not ventured recently into rural America, the jaw-dropping and visible decline of work comes as a shocker. How is it visible?
The first time Dr. Van Zee drove me around the little coal camp communities, I literally, my jaw was dropping. And even in small towns like where I grew up in a small town in Ohio, and I was visiting my little nephews that live near there recently. And we were having chili dogs at this little restaurant stand, and we were going to walk to the park afterwards. And they said, "Aunt Beth, let's drive." And I said, "Why not walk? It's right across the street. We can see it." They said, "We don't want to step on heroin needles."
But how does this decline in employment, this growth in poverty, and the number of people who are on federal disability payments, how did that feed or reinforce the opioid epidemic?
Sure. Well, as the jobs were closing, I tell the story of a woman at the beginning who had gallbladder surgery. And at the end of taking 30 days worth of OxyContin, she finds herself addicted. And her neighbor, who has just lost her job, she sort of coaches her to go to the doctor, to get the doctor to write you a prescription for OxyContin. So this woman talks her neighbor, who's just lost her factory job and needs a way to get her blood pressure medicine, into going and getting written prescriptions for OxyContin. And then they share it. The woman who doesn't really need it sells it in order to pay her bills. And the woman who's just had gallbladder surgery and is now trying not to be dope sick and in withdrawal is taking half of her pills. And that just happened times 1,000 out in that region.
So people were selling the pills as a form of income.
Yeah, it was like moonshine.
You talk to so many players in this drama. I mean, police officers and heroic doctors and community activists, and so many parents and kids, parents who'd lost kids, kids who were in and out of treatment, families in pain. I was struck that you wrote that one woman, Robin Roth, was so determined to deal with her son's addiction that at one point she had doors removed from every room in the house, so there was no place he could hide.
Yeah, yeah. There's a drug court judge out in rural Russell County, not far from Lee. I watched his hair turn from salt and pepper to white in the course of about a year. And people come up to him at the grocery store and they have kids who are addicted but haven't been charged. And they beg him, Judge Moore, please put my child in drug court, before they even have charges. Of course, he can't do that. But there's just so much desperation out there.
You refer in the book, in passing, to having grown up in an alcoholic household and living on the periphery of addiction. I wonder if you want to explain that at all and how it affected your reporting.
Sure. My dad was an alcoholic. He died of alcohol-related complications and lung cancer at the age of 57 when I was a sophomore in college. I didn't really have much of a relationship with him growing up. I didn't understand it. I still don't completely understand it. I knew the only way I could stand to live in this material was to write about the people fighting back. So if you notice in the book, at no point do I watch somebody put a needle in their vein. The only way I could stand to write this book was to write about the people fighting back. So the families and the first responders. I mean, I did spend time with users, but I would visit Tess Henry, for instance. I'd visit her in rehab. I would drive her to NA meetings, walk her baby around the back of the room when he got fussy, things like that. But I wasn't hanging out on the streets with them, unlike other reporters, just because I didn't think I could handle that. This was dark enough as it was.
Was that because of memories of your father or fear on your own part? Yeah.
Yeah, partly. And then I just thought, a friend of mine who's a writer, Roland Lazenby, he said, he quoted Mr. Rogers. He said, find the helpers. And I just thought, if I'm going to tell this comprehensive story that spans 22 years, this is the way I'm going to be able to be mentally healthy and write this book. And also maybe it's a way that people are going to relate a little bit more to a mother or to a physician or to a police officer. My goal was to mobilize people to care about this. And there's so much stigma against, quote, addicts. That was another way, write about the helpers. But because of, you get so close to these people. And this young woman, Tess Henry, who was 26 when I met her, there were moments where the journalistic lines blurred, and I wasn't sure how much I was supposed to do. It was okay to drive her to an NA meeting when she was ostensibly, quote, clean. But was it okay when she texted me a barely legible text at 10 at night and says, please come get me, and she's in a drug house? Please come get me, and she's in a drug house. Was that okay? I had to talk that out with my husband, and we decided, no, that wasn't okay. I wasn't going to do that. So I called her mother, and I called her Hope Initiative volunteer, a person who was trying to help her get access to treatment instead. I just thought that was a bridge too far ethically as a journalist.
Yeah, no, I would think, dealing with and getting to know these people so well, it would be very hard not to feel the kind of personal connection that would want to make you involve yourself in ways beyond chronicling what's happened.
Right, even to the point of when her mother's making decisions about her treatment. And I've been reading all the data, I've been calling up the nation's experts, and I see her mother sending her off to an abstinence-only based treatment. Do I say something? Is it my role to say, yeah, but the best kind of treatment shows that Tess is going to have a better chance of getting out of this if she gets medication-assisted therapies. There was at one point she was trying to get her home when she was living homeless on the streets. And I actually said, she needs to get back on Suboxone again. She's not going to be able to make a bus ride home for 3 days. She's going to be dope sick and in withdrawal and having fevers and sweats and diarrhea. She's not going to want to do that. She's not going to be able to handle it. She wasn't able to handle it before. Why do we think she's going to handle it now?
So when that came up, when you thought, decisions were being made and the mom was making decisions that you thought weren't going to take this kid in desperate need in the right direction, did you speak up? Did you say, think of a different way?
I spoke up gently, I should say. I mean, some of this stuff took place over text. And I remember I quoted one of my texts in the book. I said, I know Suboxone is abused because she kept seeing examples. She works in a hospital of people coming in with abscesses from injecting Suboxone. I said, I know Suboxone is abused, and that's wrong, yes, but at least there's no fentanyl in it. I mean, the whole thing is we got to get these people better. And in order to do that, we don't want them dying from fentanyl and even harder stuff.
You write a lot about fentanyl and the impact of this chemically produced opioid, which began to be shipped in from China and was used to lace heroin in some cases. What was the impact?
Well, it really first hit Roanoke here where I live in 2015. There was a big spate in June. We had the highest rate in the state. And dealers started cutting their heroin with fentanyl because it's easier to smuggle, because it's much tinier. Just a few granules, can really go a long way.
And why is it more deadly? Why does it cause more overdose?
Because it's 50 times stronger than heroin.
You write about an effort to deal with this crisis in Roanoke, something called the Hope Initiative, which involved a lot of moms who had dealt with this, some who had lost kids to overdoses, others who had kids who were struggling. And Roanoke's police chief was involved. What did they try and do? And what were the obstacles they faced?
Yeah, so they were basing a program on a Gloucester, Massachusetts police chief program where the goal was to divert users into treatment instead of jail. In Massachusetts, they already had Medicaid expansion. In fact, the Affordable Care Act was sort of based on what was earlier called Romney Care. So they had much more treatment facilities, and most of the treatment facilities in Massachusetts, all of the treatment facilities in Massachusetts that get Medicaid, Medicare funding by law have to offer medication-assisted therapies, which is buprenorphine, which goes by the brand name Suboxone, or methadone. Those are the two most efficacious drugs for preventing overdose deaths. In Virginia, which did Medicaid, and it has yet to trickle down because the General Assembly just passed it a few months ago, there were fewer options to send people to treatment. So these women, very well-meaning recovery advocates, would end up sending people away to rehab, many of them in other states, and largely faith-based, and where people were not permitted to take medication-assisted therapy. So I watched people die. I watched one young girl who had been successfully on.
Let's talk a little bit more about this medically assisted therapy. And when we talk about using medications like Suboxone in drug treatment, as opposed to abstinence treatment where you don't use drugs, just explain what we mean by that.
Sure. Most rehab centers in America do not offer medication-assisted therapy. Very few offer all three kinds of medication-assisted therapy. Rehab centers historically came out of treating alcoholism, and they are AA and NA based largely, which just isn't as effective with opioid use disorder, effective in 10 or 11%, as opposed to Medicaid-assisted therapies, which have shown to prevent overdose deaths in 40 to 60%. It's a tough thing to get better from. John Kelly at Harvard says it takes the typical opioid use disorder patient 8 years and 5 to 6 treatment attempts to achieve just 1 year of sobriety.
And when you mentioned these drugs like buprenorphine, Suboxone, what do they do?
They stave off cravings, and they allow their opioids themselves, but they have a blocker. So if you take them correctly, you don't get high. And in the meantime, while you're taking this drug and you're getting your counseling and your check-ins with your support groups, you can be getting jobs back. You can be getting your kids back. Some people in the coal fields now who've been on this program are even getting off of kids back. Some people in the coal fields now who've been on this program are even getting off of disability now. And that gives me a lot. The only way you can afford to come back next week, because it costs $100 each week, is if you sell half of it. And I almost didn't believe it. And then I just heard it from one person after another
let me understand this. I mean, so this drug, which is shown to be somewhat effective in helping addicts kick their addiction, clinics have popped up which take only cash, right?
Right.
And they want to sell more of it so that the users will then sell part of it to other people. And why would people buy it?
Because they don't want to be dope sick. Because there's a huge need for it. There aren't enough physicians who have been waivered to provide buprenorphine. And the people who are addicted to pills, who are trying to get their life back, they'll even buy it on the street.
And so they're not buying it to get high. They're buying it to help get off of heroin, right?
Yes.
So why don't
or pills? Yeah.
So why don't they go to the cash clinics themselves and buy it rather than buying it illicitly from somebody?
There aren't enough doctors is one big reason. In 1987,
illicitly from somebody.
There aren't enough doctors is one big reason. In 1987, France was having a bad opioid problem, bad heroin problem. They took the waiver requirement off and they made it so that all doctors, just like with opioids, you don't need special training to prescribe opioids. They made it so that all doctors prescribe buprenorphine, and they cut their overdose rate by 87%. They expanded capacity times 10. And in Roanoke, where
you said that judges who have drug courts in Virginia, and these are courts where people who have addiction problems can get, treatment as an alternative to incarceration, mm-hmm. that the judges in those drug courts didn't like the idea of medication-assisted therapy. They didn't want Suboxone or other stuff. And as a result, they've been less effective than they might have been. Is that changing? Are judges and law enforcement more open to it now?
I think it's starting to change. Judge Moore, who is not against having MAT in his court, medication-assisted therapy, his prosecutor was against it, but now the prosecutor is starting to allow Vivitrol, which is a shot. You take it once a month. It's something that's controllable. So law enforcement's a little more comfortable with it. Experts believe buprenorphine and methadone are actually more efficacious, but let's start making inroads where we can.
For a long time, people have been using nicotine patches to get off cigarettes. Is this a reasonable analogy? Why is it okay for that and not for someone with a more destructive drug addiction?
That's a great comparison, actually. And a lot of people think it's like giving a diabetic, insulin. It's a maintenance drug and it's a harm reduction strategy.
The Centers for Disease Control has just come out with some preliminary estimates of the opioid crisis for 2017, I think, and show that overdose deaths.
Virginia do not. And I think we just have to have leadership at the state, at the local, at the federal level of a big scale and intensity. And the House has passed 60 opioid bills, but most of the recently approved monies are going to short-term programs. And what we really need, Andrew Kolodny, who's one of the leading voices in the epidemic, says we need $60 billion, not the $4.5 billion that's been allocated. We need $60 billion over the next 10 years in order to start a whole new system that would be integrated into our health system. That's what it's going to take, according to him.
Are you still in touch with these families that you got to know so well in this book?
Oh, of course. Of course. The woman who shook the urn at the 2007 trial from Florida, her name's Lee Nuss. I'd only interviewed her on the phone. Her husband died about 2 weeks ago, and it was his dying wish that her niece drive her up to Roanoke for my book event. And here she came. She's about 4'10", and she had Randy's urn with her, the little tiny brass urn.
But that's the ashes of her son who died of an overdose. Yeah.
Yeah, that she had shook at the Purdue Pharma executives. And she came to my book event and spoke a little bit. I'm in touch with Patricia, Tessa's mom, almost every day. She's going to go out and do some of my book talks with me. And this is,